Welcome back, 627 on this Friday. It's Wear Red Day, part of February, being observed as American Heart Month. And yeah, we've got a special guest in studio to talk about more.
A physician assistant, Samantha DeLucia from UPMC Hammett. Thanks for joining us.
Thanks for having me.
This is such an important day for women in our community,
Yeah.
and all of us can help just by wearing red. So do that today if you can.
I see lots of red in the studio today.
For sure.
We are on board wholeheartedly,
Yeah.
but how can folks learn to take better care of their hearts?
Well, by having conversations with their healthcare providers, and for starts, women can come to the Wear Red event today, which is at the Bayfront Sheridan. And so there'll be lots of information, lots of screenings there, lots of healthcare providers that you can talk to.
Some of these things that you do at the Expo, I've been a number of times, they're so simple,
Right.
so quick and easy. Why do you think it is people don't necessarily do these things regularly?
Well, I think especially for women, there's not a big focus on heart health. You know, we focus on other things like especially breast health. And so for women, it's not always in the front seat. And so it's very important because women are at high risk for cardiovascular disease. It is the #1 killer of women. And so it's very important to know your risk factors, know how you can reduce your risk. And that's what today's event is all about.
I think the general perception that those heart health risks kind of increase as you get older. When is the right time for women, and I guess all of us, to kind of be really focusing in on that heart health? Is there ever a point where you're too young to be thinking about it?
Well, you know, I would say maybe in your 20s, you're not too worried about it. I just turned 40 last year, so now I'm starting to think about what can I do to prevent myself from developing cardiovascular disease. So knowing your risk factors, though, smoking is a big one, so not becoming a smoker if you are a smoker trying to quit. Knowing your family history is very important. Unfortunately, something you can't change, but it's important for us to know that as healthcare providers.
But if you are able to quit smoking, say, or take one of those preventative steps, how much of an impact can it have?
Significant, especially smoking. Smoking is one of the biggest risk factors for heart disease, among other things like diabetes. If you have diabetes, you want to make sure that that's well controlled. High blood pressure, you want to keep an eye on your cholesterol. So all of those things in combination can help reduce your risk in the future.
Have you seen people come to this expo and have that sort of aha moment?
Well, fun fact, I've been working in cardiology for a long time, and this will be my first time attending because I've always been working.
Okay.
That makes
So this
a lot
is the
of
first,
sense.
yeah, this is the first time I've had time to go. So I'm actually excited to see everything in action. Our team's been working really hard to put everything together, and I'm excited to talk to, you know, everybody who's attending and, you know, answer any questions they might have. We're also giving a mini lecture series, so there'll be lots of great learning info there for everybody.
And we saw the details briefly, but if folks want to go, it's 8 to noon?
It's from 8 to noon. It's at the Bayfront Sheridan. Free entry, free parking. The first 250 people that come will get a free gift bag as well.
Nice.
Some refreshments, healthy snacks. So lots
Coming
to
up pretty
see
quickly.
there.
We're about an
Yeah.
hour and a half away from kicking this one off. So.
Thank you so much for
Yeah.
coming in this morning.
Thanks for having me.